This is part 2 in our new 8-part series that explores the ins and outs of identifying the best patient intake solution for your healthcare practice. Not all patient intake solutions are created equal, which is why it's important to know about the different program features, functionalities, and shortcomings. With the increasing ease of finding medical information online, patients the world over have become more actively engaged in their own healthcare. Search engines like Google and websites such as WebMD allow these patients to read about diagnosis and possible treatment options or do preliminary research to identify an affliction when they experience a new, unexplained symptom. In fact, almost 90% of patient healthcare research is now done online, a statistic advertisers have not ignored. With millions of health-related searches being conducted every day, pharmaceutical advertisers and marketers have found a ready audience of consumers either suffering from an illness, researching a set of symptoms, or planning a treatment course to whom they can peddle their wares. For these advertisers, every online search presents an opportunity to hawk their product or service as a remedy or solution. This is both a good and bad thing. It's great that patients are becoming more engaged in managing their own health, but as we all know, without the guidance of a trained physician, these patients are also susceptible to clicking on an advertisement that may or may not ultimately benefit them. An ad or advertorial content may follow that patient onto their social channels, appearing in a newsfeed or sidebar, hoping the patient will click through and learn more. Again, this is fine, but without the supervision of a physician, might lead patients to only be familiar with one option when several might exist. Add to this phenomenon the fact that many quick-to-market patient intake and similar applications have chosen to offset some of their product development costs by integrating so-called life science features into their platforms. Unfortunately, in most cases, life science takes the form of advertising designed to integrate consumers with certain pharmaceutical brands, products, and services under the pretext of educating them. In some of these cases, a patient might be making an appointment with a specialist to, for instance, have their blood pressure checked. During their intake procedure, they might be shown displays seemingly intent on educating them about blood pressure anomalies, but which actually steers them toward a particular medicine or treatment. These advertisers count on the patient's digital engagement with the platform to fuel their ad campaigns and augment their databases. Similarly, ad tech companies use AI and big data to approach healthcare practitioners and entice them with their wares. Is this really the type of solicitation that should be integrated into an intake platform that's designed to be a confidential conduit between a patient and practice? Does the intrusion of a third-party vendor cheapen the doctor-patient relationship if their messages are everywhere the patient and healthcare provider turns? At Yosi, our pre-arrival focused, highly rated, digital patient scheduling, registration, payment, communication, and reputation management solution is designed exclusively for the healthcare centers and patients they serve. It is important that there is a comfortable level of trust and transparency in that relationship, a value that should be honored by the platform that brings these two groups together. It's why the Yosi Health integrated solution has chosen not to accept pharmaceutical display ads or pay-per-click banners to clutter up the experience patients are seeking with their practice through our platform. Since our inception, it's been an important differentiator that we think gives our suite of services a significant degree of integrity above the rest. To find out more about our intake tool and the values we embraced in developing it, please give us a call.